All right, welcome back. So in this segment of Down the Rabbit Hole, we're going to be talking about social distancing. We're going to be talking about viral shedding and how long someone could be contagious with the virus. We're going to talk a little bit about some of the collateral damage of what the quarantine has done health-wise and economically. And then we're going to wrap up going into the testing, the different types of tests, how accurate they are. And so we're going to cover a lot in this segment as well. But first, let's just start with the social distancing. I know here in New Jersey and really every state I'm aware of, it's 6 feet is the recommended distance between people. I know a lot of people are wondering where the 6 feet come from. Wanted to share an article with you that, again, this is from the Journal of the American Medical Association. This study was actually a study that was what's called an epidemiological study, where they looked at a bunch of other studies. They did this in March, and it says turbulent gas clouds and respiratory pathogen emissions. Basically, how far can a sneeze or a cough travel so that we can compare that with the 6-foot guidelines for social distancing. Dr. Steve, any guesses of how far a sneeze travels according to the article?
I would say a few times more than 6 feet.
Yeah, they actually said in the article anywhere from 23 to 27 feet. A sneeze can travel. And I don't know about you, but when I think of 6 feet, if someone sneezed in my direction from 6 feet away, I'm feeling those droplets.
You're going to feel it.
I'm feeling those droplets. So really, like, what have you seen and what have you seen with this 6-foot distance thing doesn't seem to have a whole lot of data to support it. What's going on with the 6-foot thing?
Adding to the fear of contagion, across the nation, we're being driven to practice this social distancing. And they're saying 6 feet. In the UK, they're saying, 2 meters? But there's researchers that say this is all bunk, and it's not based on science to do this. There's a couple of scientists from the University of Oxford in Britain, Professor Carl Hennigan and Thomas Jefferson. They wrote in the Telegraph, quote, "The 2-meter rule, 6 feet for us, has no basis in science." And their article was titled, "There is no scientific evidence to support the disastrous 2-meter rule." And the thing that they were in affront to was The Lancet is a very influential publication. They provided evidence from 172 studies in support of physical distancing, but all those studies were subject to what's called recall bias and numbers, like games that they can't justify. And when you have this kind of numbers bias, everything is skewed. Yeah. And when you break it down, those 172 studies, there was only 5 that actually had to do with COVID specifically, and only one of those studies actually measured the distance between the patients or the applicants. So that one study, the only one that's truly scientific, showed no effect of distance on contracting COVID. So again, the science is still on the side of that it doesn't make any sense to be social distancing, because there's other consequences too.
Even the term, the term social distance, we've been saying this from the get-go. You could say, personal space, you could say physical space, whatever you want.
Physical distancing.
Social distancing is an intentional term,
right.
And we could have a whole conversation about that. But then the other part of this whole thing, if the 6 feet is not based on science or anything, and truth be told, I think the most common sense person could say a sneeze travels more than 6 feet. So they know that you're not going to socially distance an entire society 22 to 27 feet. And we're not proponents of that either. We're more just bringing this up of the absurdity of 6 feet and how it's not really going to do anything. And then again, the research supports that from the professors in England. So ultimately, at the end of the day, when we look at this here, guys, 6 feet is not based on science. Again, it's a propaganda. It's a manipulation thing. And at the end of the day, you are, again, an immune system, and you need to interact with things. And just on a side note with that, I don't know about you, but we're familiar with something called the hygiene hypothesis, which means that your immune system gets stronger the more it's exposed to viruses and bacteria and pathogens.
Sure.
And so
everything in the human body requires training. How do you train the immune system? By exposure.
It needs to happen.
Yep.
It needs to happen. All right, so the next part that we want to touch on in looking at this is how long is someone that is, let's say they are experiencing an acute infection of COVID-19. Again, I didn't say disease, I said infection, because it's not a disease. An acute infection of COVID-19, how long is that person contagious? Well, this study here from April 3rd, 2020, coronavirus virological findings from patients treated in a Munich hospital. In this study out of Germany, they actually looked at and they measured the presence of the virus in the nose and the throat of a number of patients. We're going to edit that out. In the nose and the throat of a number of patients, all right? And what they found was that they found the presence of the virus from days 1 through 7. Once it got to day 8, they could no longer find the presence of the virus. So again, we have to ask ourselves, where does this number of 14 days of quarantine come from? Or even more in some cases, I've seen 21 or even 4 weeks of quarantine. Where's the science to support that? So again, in April of 2020 out of Germany, they're saying 1 week only is necessary to quarantine. What's up with the 14 days?
There's no science that backs it. So, you're asking where does it come from? It comes from the mind of our legislators. This is capricious, arbitrary, executive orders, and they're doing this worldwide. If you travel to another country right now, if you have a 3-week vacation, guess what? You're quarantined for 2 of it. If you have a 2-week vacation, you're locked down your entire time. So it's absurd.
Well, the other part that's ironic, and I know a number of people from New York and New Jersey that went to Florida, and they are pulling people over. They're stopped. They get their information. I said, well, then what happened when you were in Florida? They said, we went about our vacation. I said, so no one followed you around and made sure that you stayed inside or that you did anything else? They said, no.
That's actually reassuring.
Went about our vacation. So again, there's no meat to it. So it's really just intimidation and that sort of thing. So again, let's talk about the collateral damage here.
Yeah, well, it's not like the United States is the only country experiencing this stress and duress of all these COVID rules. Worldwide, you have countries like South Africa, China, Pakistan, Israel, Iraq, Lebanon. The list goes on and on. Poland, Russia. They're all protesting, different reasons for protesting, like with all the COVID fallout. And this list of reasons, and pay close attention, they're financial hardship, censorship, lack of education, Gestapo-like police practices, inability to access work across the border, abuse of female populations was reported, and there's protests on that based on different guidelines, religious persecution, abject hunger for lack of work, inability to fish or have commerce at all, misappropriation of food aid. Some countries are protesting because they feel the coronavirus pretext was just basically to establish total control over the citizenry. That's an opinion that's going on worldwide. Lack of scientific evidence, the psychological impact on both children and adults, abuses in healthcare and the destabilization of families, the destruction of homes and properties. That one's unbelievable to me. 7,000 homes were destroyed in Kenya based on some idea that the virus was contaminating these homes. I mean, did the virus become termites? I mean, does it live in the rafters now? I mean, you got to wonder what they're trying to say. And also, there's been reports of the killing and kidnapping of citizens. So clearly, this is a lot of damage. Excuse me for my phone. This is a lot of damage for a virus that has a 99.99% survival rate. And it's also been listed on the CDC website as the common cold. So clearly one could argue that the fallout from all this orders and all this regulation worldwide is far exceeds this what would otherwise seem like an innocuous bug. Yeah. And granted, we know that people are reported like death rates and everything, but there's also statistical manipulation on assigning COVID to those deaths, and that's another one for a future episode.
For sure. And really, medical doctors around the globe have been talking about the other impacts of all different parts of the population. This article here that we have up here from Reuters, the UN warns of economic downturn that could kill hundreds of thousands of children in 2020. And again, going back to some of the economic points, between any number of reasons, parents not being able to work, suicides, deaths from a number of causes there, is going to leave children in precarious position. Not to mention psychological effects.
Sure.
There's so many aspects to this that, again, for the leaders of the world and the leaders, and even in our country, of individual states, to support their decision-making process about, trying to prevent an illness that has a 99.7% survival rate.
Right.
I know it's extremely high, and it's getting the weakest of the population, the elderly, the immune compromised. Meanwhile, all these other people around the world are going to be dying in just unconscionable numbers.
Right.
And then lastly, we talked about some of the doctors that even mentioned people that weren't getting proper care for heart conditions or cancer screenings or different things. And we're going to see a lot of that right here in the United States. All these preventable illnesses that people could have avoided had they been getting proper medical care during this time.
Sure. I mean, you got the medical conditions that are, skyrocketing for lack of care because they don't have access, or there's just these obnoxious rules about interacting with one another. And basically, we're social creatures, and the social distancing thing has increased depression, anxiety, and other health consequences. There's actually a landmark study back in the 80s that said social distancing weakens the immune response. So again, are we being told the right thing to procure our health, or are we being controlled in a societal way that it's going to demonstrate how the world is shaped in the future? And certainly our legislators talk about the new normal. Let's talk about some of that. Didn't you mention something about your soccer, the rules for your soccer team?
Yeah.
The new normal is not normal at all. There's only normal and abnormal.
Sure.
And we're leaning towards abnormal now, and we really need to be aware and fight this as a society.
Yeah, absolutely. And again, we'll get to the testing in a minute here, but just some of the absurdity of how we're making decisions based off of a lot of data that's very
junk science.
Yeah, and a lot of it, and even actually, let's go into the testing real quick, and then we'll come back to that.
Okay.
Again, if we have really good quality testing that can drive decisions for leaders of states and countries, then that would be good. But the reality is a lot of the testing just isn't simply as close to accurate as we would like. But let's talk about it real quick. So many of you are familiar with the nasal swab test, where they stick a probe like way up the nasal passages, upwards of the frontal lobe of the brain, to get a sample. The purpose of that test is to try to detect the presence of COVID-19, the virus in those mucosal membranes. And that has a pretty quick turnaround. It's about 24-hour turnaround to get results in that. There's another saliva test that's done where they'll do a swab in the cheek. The downside to that test is it takes more like 5 days. Again, both of those tests have error rates, which we'll get to in just a minute. But the other option are the blood tests, all right? And so the blood test has been controversial from the get-go, again, about how accurate they are. But one of the main things that we look at with the blood test is it's going to measure two different types of immune response. It's going to look for the presence of IgM antibodies, which are going to be there presently when someone's in an acute phase of the infection. We're also going to be looking at IgG antibodies, which is more of a long-term immunity type of presence of antibodies. All right, so again, if someone had something like chickenpox as a child and they were tested, their IgG antibodies would show a presence there, meaning that the immune system has fought a response to that virus. All right, and so again, IgM, IgG, two different things, both accomplished with blood antibody testing. All right.
And it would typically mean you have an antibody, which means you're not contagious as well.
And
that's the old standard. It's been forever.
So the presence of IgG means that essentially you're a healthy person.
Right.
You don't have symptoms. You have a presence of the antibody, meaning that your immune system has now a memory of that virus and can fight it in the future. And that's really the premise behind vaccine presence in science, is going to be that people have current antibodies in their blood. Now, again, looking at the effectiveness, we were seeing from the CDC as recent as May 27th, what kind of error rate are we having across the board on these tests?
Anywhere from, I've heard 40%, 50%, up to 85% false positives. So let's take the average, let's say 50%. You're taking tests that basically are reduced to a coin toss. And then if they retest, they want to corroborate it. Even the retest is done by the same standard, is up to a coin toss. So it's almost arbitrary. You could be COVID positive or COVID negative, deemed either
Sure.
one, and neither one could be factual.
And understand that decisions are being made that impact the economy, lives, jobs, so many different things, movement, so many things, stock market. When we look at all these different things that are based on 50% possibly accurate testing, it's really a shame and it's dismal when we look at that. So again,
and quarantining. Basically, the rules of quarantining used to be you had to be sick in order to be quarantined. But now we're asked to accept all these legislative rules based on the pseudoscientific idea that the asymptomatic people are transmitting disease. And yet there's nothing that can support that.
Nothing supports that. And we actually forgot to mention the study that came out of China early on. And there was like 470 people in the study, and they had 10 people that were known positive carriers of antibody tests. They had the IgG positive test. I know. We had the IgG positive test, all right, meaning that there was a presence of antibodies in this, okay? So they had 10 people that interacted with over 470 hospital staff at this particular hospital. Not one of those people were infected by the asymptomatic, again, positive IgG carriers, meaning that those people had immune system reactivation. They had antibodies to the virus, and no one that came in contact with them, not one, actually got sick with the virus.
Yeah, so that would corroborate why the old rules are still the better rules as far as quarantining go.
Yeah, exactly. So again, just on a lighter note, just to kind of laugh a little bit about what's going on. In New Jersey, they're reopening. I think we're in phase 3 now, so they're starting to allow like non-contact sports. My neighbor was telling me that their child's soccer team, they could practice. They had to wear a mask onto the field. Then the boys could practice. But the best part is the coach had to remain in the car. So coach is in the car, coaching from the car while the kids are practicing. I heard in baseball, I know a lot of kids are playing baseball as well right now. In baseball, there's no touching. The coach can't touch or instruct or anything like that. Maintain the false 6 feet of social distancing at all times. It gets better. You hear about some of the daycares and things. Yeah,
my daycare, they told us that they would be wearing face masks. They can't share a toy. They're going to have plexiglass compartments to separate the children. I mean, it's absurd. At the golf course, they put a special plastic insert into the hole so you gently take the ball and don't touch the cup. I think we've gone crazy. Sure. You want to know? Sure. I personally am not subjecting my child to such an environment where he can't interact closely, he can't show his face, and he can't share toys. Aren't we supposed to teach them to share? So the new normal is abnormal, and it's something I'm not going to be a part of.
Sure.
And again, I think it's a choice.
That's a great way to end the segment. The new normal is abnormal.
Yeah.
All right. Signing off here. We will see you next time on the next edition of Down the Rabbit Hole. Dr. Devin Coughlin, Dr. Steve Safka. It's been great. We look forward to coming back with some new information for you next time.